Now, why has Ebola kept launching a comeback in the Democratic Republic of Congo, DRC? And can Ebola be eradicated? First off, the DRC is facing its 10th Ebola outbreak since 1976, when Ebola was first identified and named after a river in the north of the country. The death toll from the latest Ebola outbreak in eastern North Kivu region has now risen to 49, first reported on the 1st of August. The government and the World Health Organization, WHO, have said they expect more cases there in this latest outbreak.
If this information is worrying, it is all the more so as it occurs in a particular context and conducive to a worsening of the situation. The DRC has experienced the 10th Ebola epidemic since 1976, but this is the first time that the virus has been rampant in a densely populated armed conflict zone with significant population movements. Benny and his region live under the threat from Uganda's Allied Defense Forces, ADF, allegedly responsible for the massacre of several hundred civilians since 2014 and the displacement of thousands of people.
Professor Paul Hunter is an expert in the patterns, causes and effects of emerging infectious diseases, including Ebola. He was the lead media commentator during the outbreak in West Africa in between 2014 and 2016, and he had recently said conflict in the Democratic Republic of Congo, DRC, migration out of the war zone, and poor sanitation in refugee camps mean that the latest Ebola outbreak will be hard to control. And Professor Hunter is with us now over the phone. Thank you for joining us, Professor Hunter. How badly is conflict in some parts of the DRC affecting a response to the Ebola outbreak in the country?
Looking at the reports from WHO and others, people are managing actually to get into the areas, but the infection has spread to another region within DRC over the last week or so, and there have been concerns about the disease spreading into Uganda, but the Ugandan authorities have increased surveillance of people moving across the border, particularly refugees, and although they identified 3 possible cases, fortunately all of the cases that they've seen so far have been negative, so that there's no evidence of spread to Uganda at the moment, but that is always a concern, and I think one that is being taken seriously by the Ugandan authorities.
But how about the question of preparation of medical workers, including training and the expertise vis-a-vis poor funding and limited access to health care? What is your view on this?
There is an urgent need to train people how to manage patients with Ebola, and it's not just how do you treat the patient. It's also about how do you make sure you as a healthcare worker don't do something that puts yourself at risk. Now, fortunately, with the new vaccines that we did not have 4 years ago in West Africa to anywhere near the extent, are available, and that will go a long way towards protecting the healthcare workers while they're actually managing and treating affected patients. But the way that this disease the spread will be stopped by effective vaccination programs, and I think as long as you can actually get to the patient.
Now, Professor Hunter, as an expert in patterns of emerging infectious diseases, do you see DRC and the rest of Africa kicking out Ebola completely?
No, that will never happen. And it won't happen because actually the disease is not a disease of humans primarily. It's a disease of animals. And the disease spreads amongst wild animals. Probably for Ebola, the most obvious animal is the fruit bat, and in the West African outbreak a few years ago, many people think that the disease spread into humans when children were playing with a dead fruit bat that they'd found, and that's how the disease jumped into humans. And it will be impossible to clear that from its animal reservoir. So there will always be small outbreaks of Ebola. I think the critical thing is that on the times when it does spread into humans, that people actually diagnose it quickly and then instigate rapid vaccination programs, so that we don't see the big, the huge disaster that we saw in West Africa 4 years ago.
And that disaster surely no one would want to see again. Professor Hunter, I'd like to thank you for sharing your insights on the subject. Thank you very much. Expert in emerging infectious diseases, Professor Paul Hunter, there speaking to us from the UK. You're watching The Morning Call here on Africanews. On our website, you can catch all these and other stories. Please visit Africanews.com. Now, still to come, we take you to Cairo, Egypt, to discover an exhibition that depicted the daily life of the inhabitants of the Egyptian capital. We meet with the founder of the gallery, whose goal, he says, is to preserve the cultural features of Cairo. This plus more stories from the world of business and sports coming up right after the break. Don't go anywhere.